Yes. We're really very privileged today to have Dr. Susan Steen present to us today. She's going to talk to us about a trial called the Bio Hermes trial, which is a study by which we identify people who are at risk, or more importantly, candidates, maybe candidates for disease modifying therapies for Alzheimer's. I like the Bio Hermes study because they do the cognitive testing, they do the PET scan, and they let you know right then what your problem is. So Dr. Steen is a clinical neurologist who actually does the testing and administers the medication. She had been in academic practice, but now we work a little bit more commercially doing just this kind of research. Dr. Steen, thank you so much for joining us. She is here with us as part of the Global Alzheimer's Platform. And Dr. Steen?
Hi, Dr. Parker. Thank you so much. And congratulations on your 5-year anniversary. That's exciting. So yes, I am was a clinical neurologist for 40 years and now doing clinical research, which I've also been doing for a long time, but just do it full time now with Global Alzheimer's Platform. And we have a really exciting study that I want to tell you about called Bio Hermes 2. Bio Hermes 1 was previously done. Bio Hermes 2 is a bigger and better biomarker study and will enable us to get a lot of information that we'll be able to use for decades and decades. And so I'm happy to tell you about it. So this is a non-interventional trial. It's looking at biomarkers, values of which we already know the significance. So we're looking at baseline amyloid PET, tau PET, and CSF, and MRI. But we're doing further studies on MRI. So we're looking at 3 imaging studies and multiple other digital and blood-based and other biomarkers. So we are asking people to participate and volunteer to give us biospecimens. We're looking at folks from 65 to 90 years old. We have 3 cohorts. We have a cohort of normal cognition, mild cognitive impairment, and mild to moderate dementia. We're looking for 1,200 patients. Most of our sites are in North America, United States, and Canada. We have a few sites in the UK. We are asking people to, again, do 3 imaging studies. One is an MRI without contrast with a high intensity 3T Tesla MRI, looking at diffusion images.
Dean, are we supposed to be seeing slides? Did you have slides?
I don't have any slides.
Okay, all right. So,
unless somebody else sent them. I did not send any in.
Okay, just for the benefit of our audience, can you tell us why you're doing 3 different scans and why that's so important? Because everybody doesn't know.
Okay, sure. So these 3 scans have FDA approval. So these are kind of mainline, especially MRI and somewhat amyloid PET. So the MRI is a test looking at volume, particularly hippocampal volume, but global volume. We're very interested in understanding how that presents in those 3 cohorts that I told you about. The amyloid PET scan is an approved scan and a very sensitive scan for Alzheimer's disease. We see positive amyloid PET scans maybe 20 years before people start having symptoms. So it's an early and accurate way of diagnosing Alzheimer's disease. And that's really what we do now. We look for amyloid pathology and tau pathology to make a diagnosis of Alzheimer's disease, which with as much certainty as we can. And then the 3rd scan is a tau PET scan. We're looking at 2 different tracers for tau. So both the tau and amyloid PET scans are radioisotope driven scans. So a radioisotope is made that attaches to amyloid if we're doing an amyloid scan, or to tau if we're doing that scan, and it is injected into the patient or subject, and we wait a while it's being taken up into the body, particularly in the brain. And then we put folks in a scanner, which is a CAT scan machine. And the neuroradiologist can tell us if there's a burden of amyloid or tau that is consistent with Alzheimer's disease.
There's a question in the chat about having an open MRI for your study. You do, I would imagine that you're using the MRI as kind of like a screener just for normal architecture. And then when it gets to the more specialized amyloid and tau PETs, you're looking for those proteins specifically. And even if they're there, everybody may not necessarily know the mechanism or why we're looking for these two proteins. And the question in the chat is there an open MRI? Or do you accept the open MRI in this study?
No, we do not. So there's several reasons for the MRI, and those reasons and questions are being kind of brought up as we go along in the trial. But there's a very big interest in understanding the component of vascular dementia in people who may look like they have Alzheimer's disease but have a negative amyloid PET scan. And that's particularly true in certain ethnicities and races. It's particularly true in both Hispanics and particularly African American Blacks, where the incidence, as you know, is twice as common as Alzheimer's disease in white folks. So the question is, what's going on? Is there a component of vascular damage that is contributing to the cognitive impairment? So we use a very high intensity MRI. So we use a 3 Tesla. So that is a closed scanner.
Okay, and that closed scanner, is that 3 Tesla, as you explained it, I'm thinking of the car, that's not available everywhere, is it?
No, it's not. And so it's limiting for some of the trial sites. They don't have easy access to 3 Tesla, but that is what we're really looking for, is a very high resolution scanner looking at particular cuts and software that can give us what we call diffusion images, which can better let us understand the vascular component and whether or not there's vascular damage, such as small strokes or microvascular changes.
And so for the audience, when she talks about small strokes, it's any of us that have been diagnosed with high blood pressure, high cholesterol, diabetes, or have diabetes are at risk for having blood vessels that get blocked up, not just big ones, but little itty bitty ones that feed your brain. So you may have blockages in these little itty bitty blood vessels. And when that happens, the brain cells die because they're not getting any blood. And so that is the mechanism behind what we call vascular dementia. Brain cells aren't getting enough nutrition supply from their blood flow. And that's why we're looking at that. And a lot of people who have a diagnosis of dementia for any kind need to be clearly diagnosed. So Alzheimer's is one type of dementia, as you're well aware, if you've listened to us at any time before. There are all kinds of dementia. And as research progresses, we're learning that more dementias have different causes. It's not just Alzheimer's. It's not just blood vessels that aren't getting supply. It may be frontotemporal dementia. It may be alcoholic dementia. There are a number of things. And the more we can figure out tease out these different elements, the more likely we are to make sure that you have the right diagnosis for dementia, such that you can, if you need the new medications, you'll get them. But if you have stroke-related dementia, those medications are not for you, not at this time. So when you talk about your centers, and I'm hoping at some point in time we can pull up where those different centers are. I know that there is not one here in Georgia, right? There is not a Bio Hermes site here in Georgia.
I don't know that, but I can find out.
Well,
I don't think there is. I
know with
Not yet.
Yeah.
Not yet, but we're still adding sites.
Okay, I do know that with the first Bio Hermes site, they were closest site to us was in Florida. And we took several of our participants down to Florida to participate in Bio Hermes 1. And I'm personally signing up for Bio Hermes 2 for for that reason, just because I know that you're going to give us the results. And if I
Right.
can get all 3 scans at one time, why not? So a lot of us here and many of the people who are on our program today aren't necessarily Georgian. So it'd be real important to know where some of these places are. Okay, Julie, who's Julie? Okay, this is the site for Bio Hermes 2. Thank you. She gives a link to the Bio Hermes study and tells us where that is. So if we come to your site and you're in Tampa, right?
Correct.
You are working with the Global Alzheimer's platform and you are positioned right there in Tampa. How do we get to you? What is the process?
Yeah, so and I don't know if Julie has the ability to put our phone number out and our email out, but people are self-referred. They come to us and we usually meet with them and do a brief neurologic memory screening encounter. That is, of course, everything we do here is without charge, like any research institute. We have grants that pay for these things. So we don't look at insurance or Medicare or cash or nothing. Everything is free. People come and they get a memory screen and we determine if they're interested in participating in the Bio Hermes trial. So that memory screen can be scheduled within usually 2 or 3 weeks of somebody contacting us. It takes about an hour, and that we do a couple of memory screens here and an interview, and I meet with every person that comes in, and we talk about the Bio Hermes trial and other things and see if they're interested in that. And then we refer them to our what we call our clinical coordinator. So that's the person that's in charge of that trial, and we begin to plan out their visits.
And how many visits would it take to be a part of Bio Hermes 2?
So in total, it's 7 visits. So there are 4 visits here in the clinic in Tampa. The visits can be a couple of hours or they can be most of the day because we do several digital tests that I can talk about, and blood tests and interviews. And we also have a retinal scan that I can talk about too. So there are 4 visits here, and then there are the 3 separate visits to the imaging facility, the 1 MRI facility, and then there are 2 PET scans, which is a different facility, all in our county here in Hillsborough County, which is where Tampa is.
So that would happen at any of the other sites outside of Tampa, the same thing. You have a
Correct.
bunch of tests, a lot of testing that you would do for the, I'm gonna call it, for lack of a better understanding, the first visit. You're gonna do some memory screening. You're gonna do some cognitive testing, like pen and paper testing to measure more brain functions. Would that be correct?
Right. So the first encounter usually here at Axiom Brain Health is not a Bio Hermes encounter. It is what we call a SNAP, which is a Swift Neurologic Assessment program. And so folks come in and we meet with them and we determine where they are in regards to one of those 3 cohorts. Are they a candidate? Are they a person that can go in an MRI machine? They don't have a pacemaker or they're not claustrophobic. And so you check off the boxes in that first visit, and then we would move forward to enroll in Bio Hermes, which would begin their 7 visits here.
Okay, so that's a little different from Bio Hermes 1. That was like 1 visit, 1 and done.
That's correct. This is much more involved, right?
Much more involved. And if there is, let's just say, now I could, true story here, one of our volunteers, research volunteers, participated in Bio Hermes 1, and she was told she had some abnormal tests, and she eventually came to our research center and neurology department, got an official diagnosis, and was started on some of the disease modifying therapies because her scan was positive for Alzheimer's pathology. What happens in your Bio Hermes 2 if you have something wrong? I'm thinking about coming to Tampa, but if there's something wrong, how would we handle that? When I say wrong, you'd find the amyloid pathology or the tau pathology on our brain scans. What would happen then?
Well, first of all, let me say I certainly hope you do come to Tampa. We would love to have you here. So yeah, you're right. So what people are doing is they're volunteering to give these biospecimens, these parts of their body, the brain scans, the cognitive testing, the eye scan, And then those things are owned by scientists. That data is owned by scientists, but we do share the results of the amyloid PET scan with the participant, which is a very sensitive and early test for diagnosing the pathology of Alzheimer's disease. So if the scan is positive, showing amyloid burden, then the likelihood is that person does have Alzheimer's disease, even if it's very, very early, even maybe asymptomatic. So then the discussion is, do they want to choose to do something different? And the answer is usually yes. Do they want to be on commercial monoclonal antibodies, commercial medicines that can change the disease progression? Do they want to learn about clinical trials that we're doing or you're doing or wherever they live that researchers are doing? So there's all kinds of options for folks then.
Okay, so okay, I hear the discussion that you have, but if somebody from here, and there are 14, according to somebody else, there are 14 other sites. I know that there's several in Florida, there's some in Chicago. We have, I think we put the link in the chat. I'm looking right now for where they are. I can't pull it up while I'm talking to you and keep talking to you. I'm not that technologically proficient, but I think the worry for a lot of people with this particular diagnosis is, where can I go to get an evaluation? And I think we need to remind people to some degree, this is research. This isn't you're being our neurologist now. So if we find something, you're collecting images from the 3 different types of X-ray, brain X-rays, the brain MRI, the amyloid PET scan, the tau PET scan. Those are 3 different images. But you're also collecting biospecimens. Biospecimens means things like blood. Are you collecting saliva or hair or anything like that?
No, we're collecting blood. We offer people the opportunity to donate spinal fluid. We have an anesthesiologist who's doing our spinal taps for us, so she does them all day long. So people can volunteer to give a spinal fluid. But we are looking at multiple blood-based biomarkers for neurodegeneration, for inflammation, for other things, looking for some of the other diseases that you talked about, like Lewy body. So looking for some of those biomarkers. We're very interested in looking at digital testing.
What does that mean?
So that means testing that people would do using machines and computers primarily. We have several machines that folks would use a computer and they're given tasks to do, say through a headset or some instructions, and they follow those instructions. And so their performance on those tests are calculated by computers. We have a digital test called a Cumulus, where people wear a cap, which is an EEG recording of brain waves, and then people solve problems on an iPad. We have something called ViewMind, where people wear goggles and they follow commands with their eyes. And so the thinking is that these tests can give us an idea and show us a pattern that the performance may be consistent with Alzheimer's disease. So these could serve maybe as a pre-screener or as a combination, a piece of combination, looking at a blood-based biomarker and a digital biomarker. So we're exploring those things as well.
So part of the research thing, and a lot of times people want to make research scary. As I'm listening to you, all of the devices, I'm going to call them devices for lack of a better word. You talked about the cap, you talked about the vision screening. These are tools that we're using to try to find people before they get well-engaged disease, right?
Correct. We're looking for ways to early diagnose that are more efficient and less costly than an $8,000 PET scan.
Mm-hmm. And because it's research, none of this stuff is necessarily being used clinically. So here, for diagnostic sake, for everybody just to know, when you're doing a Alzheimer's evaluation in this day and age, you get cognitive testing, which is usually the completion of pen and paper test or digital processes of these same tests. We're moving from pen and paper to digital or computer generated kinds of testing. A brain image, usually an MRI, and if your research center or your doctor has one, access to a PET scan or of some sort, but most practicing clinicians who are outside of large metropolitan areas may not have a PET scan. So an MRI is a part of that diagnostic process, as is cerebrospinal fluid. So we put a needle in your spine, we withdraw the cerebrospinal fluid. So if you're a female and you've given birth and you had an epidural, that's what you do. You draw the fluid out, we analyze the fluid for evidence that you have the abnormal protein amyloid or tau protein in your cerebrospinal fluid, and that's how we currently get the diagnosis. So these other tools that Dr. Steen is explaining are less expensive, and eventually, if testing works well and they're accurate enough, will probably be how we diagnose Alzheimer's in the future, right?
Right. There's another part of the Bio Hermes that I think people would be interested in, and that is a test called ReadySpec. So that is a retinal scan. It is ReadySpec is a company in Toronto in Canada, and they have a machine which all the sites have to be able to do this for participants. So we take a picture of the retina, and we can actually see that abnormal protein amyloid in the walls of the arteries of the retina. So this is a test that we hope optometrists and ophthalmologists will have readily available in their offices. So it's important for us to understand the accuracy, the sensitivity of that test and these other tests to help us make that early diagnosis.
All right, I'm looking at some of the other questions, trying to look at this and do other things. So a lot of people think I personally think anything that gives us a better idea of what's going on in our brains, particularly for those of us who have family members who've actually been diagnosed with Alzheimer's, we want to do everything we can to make it less likely that we're going to get that disorder, and do everything we can to make things better. So this Bio Hermes 2, just to summarize, Bio Hermes 2 is another mechanism by which we are testing newer tools for learning whether or not somebody's developing Alzheimer's. The people that we're targeting are people 65 and older, correct?
Correct.
Okay, so if you're under the age of 65 and you're worried about your brain, you can't be in this study. There are research studies that are looking at people who have earlier and earlier onset. If you have any sign or clinical symptom that you've discussed with your provider that may indicate that you're having trouble with the way your brain works, it's not always Alzheimer's, but discuss it with your provider first. This is research. This is not a substitution for a clinical examination that you should be having with your doctor, who will refer you to a neurologist if that's necessary. So there are people here in the chat who are talking about which biomarkers other than amyloid plaques are revealed by a spinal tap. And in your Bio Hermes study, spinal tap or cerebrospinal fluid is optional. Can you tell them what you're looking for in the cerebrospinal fluid besides amyloid?
Sure. So first I want to jump back because Julie reminded me that I need to be corrected, that the study involves people as young as 60. So the age is 60 to 90. I misspoke.
Okay.
So a lot of the details of the biomarker studies, including spinal fluid and blood, are still being developed by scientists. So certainly we know that there are abnormal levels of amyloid. Those levels go down in spinal fluid of people with Alzheimer's disease, and levels of tau go up, tau. But we're looking at other markers to understand other changes that may occur early on, and also what happens as the disease progresses. So we have, again, those three cohorts. We have normal, we have mild cognitive impairment, and we have people with mild to moderate dementia. So what are the findings in the spinal fluid according to how the disease progresses with those biomarkers and the other biomarkers we were talking about as well?
Can you see some of the questions there in the chat?
I saw a question that was appropriate, and that was, are all the results of all of the tests given to the participants? And the answer is no. Many of these tests that we're looking at are, I'll call them outliers, because we don't really know what they mean. So the scientists will look at these tests, these biomarkers, to see what they mean in these different cohorts according to the severity of the disease, how they stack up and align with the biomarkers that we know the value of, the amyloid PET and the tau PET and the findings on MRI, how biomarkers are different in different ethnicities and races. One of the very important things, as you know, Dr. Parker, when we look at clinical trials in Alzheimer's disease, 95% approximately, sometimes more, of the people in clinical trials are white. And that is not our world. As I said, Alzheimer's disease is twice as common in African American Blacks and 1.5 times more common in Hispanic Latinos than in white people. And these people are not given the opportunity and are not educated about clinical trials. So it is the goal of researchers, and particularly in those of us that are doing Bio Hermes, to reach people of diversity. We would like to have 25 to 30% of our buckets in all 3 of those cohorts filled with people of diversity.
And that's a real important point, Dr. Steen. A lot of us are not necessarily geographically adjacent to very many research centers. Certainly here in Georgia, people who live in very rural areas, maybe 3 to 4 hours away from Metro Atlanta, would have a hard time getting in here, but they might have an easier time getting into sites that are getting somewhere closer to them geographically. But again, with respect to this kind of research and the types of cutting edge, I'm going to call them diagnostic therapies that you're testing, for someone who is worried and meets the age criteria, this is an easy way, I think, to get your toe in the door for making sure that you get where you need to get for an evaluation. If you are at risk, if you have a family member who had some type of dementia but wasn't necessarily diagnosed with Alzheimer's, it might be to your advantage to go to one of these sites to get these studies. We do some of these studies here. We do lots of cerebrospinal fluid analyses here. We do some PET imaging. We have some tau imaging. There are different studies and there's different criteria for all of them. But this Bio Hermes study is giving you 4 different kinds of testing all at once. I'm saying all at once. It's not a substitute for a neurologic evaluation, but those things that are medically actionable, they'll be given access to, right? And to take back to their doctor, or we'll discuss it with you first. The results are discussed with the neurologist on site, right?
Right. Yes, we discuss the results with the participant of the amyloid PET scan, and in some cases the tau PET scan. It depends on which tracer they're using, but the amyloid PET scan is a very important piece of information to make that diagnosis.
So Ms. Hollis asked, she said, suppose you don't want the biomarkers but are willing to do the other testing, and I guess she means cerebrospinal. I think she means cerebrospinal fluid. And you did say that was optional, but willing to do the other testing. Is that acceptable?
Absolutely. Yes, very much so.
So you mentioned blood biomarkers. You mentioned 3 different imaging studies. If you consent to the study, you must do at least the blood biomarkers and 3 scans. Is there any part of that you can refuse?
You know, I don't know that there's any part you can refuse. You pretty much, volunteer, and it's the risk of participating in the trial, the risk of the procedures are very minimum. The MRI is done without contrast. The imaging studies, there is a radioisotope that's injected. It's very quickly broken down, so it wouldn't cause any lasting effects. And then we ask people to give blood and do the retinal scan. If people have significant eye disease, they don't do the retinal scan, but most people do it. And most people are willing to do everything. everybody is so far, and the digital tests, as the machine tests, as I told you.
Okay, so for everybody here, if you live in Georgia and you're interested in Alzheimer's research study, you can certainly come to see us here at the Emory Goizueta Alzheimer's Disease Research Center. We have contact information that we're going to be putting in the chat, and you've had access to all the time if you're with us all the time. But Dr. Steen is here talking about the Global Alzheimer's Platform and the opportunity to participate in the Bio Hermes 2 study. It's a study where they're going to do some screening, cognitive screening, but they're going to employ different types of diagnostic tools to look at your brain and try to understand whether or not you are at risk for having Alzheimer's. That involves getting a brain MRI. It involves some vision tracking, as she says, but two different special scans, brain scans that aren't really widely available much outside of research. One of them is an amyloid PET scan, and the other one is a tau PET scan. And when you participate, it's 7 visits, as I understood it. And I guess your compensation, somebody says, well, you're going to give me a payment for that. I mean, I have my thought on that, but somebody's going to ask, if I'm doing this for research, are they going to pay me for participating?
Yes. Yes, people are paid. I'm not sure what the amount is. I don't think you get rich being a participant in clinical research, but we pay for people's time. We also provide transportation. The transportation is limited, I think, to a 1-hour radius from our center, but we can provide transportation through Lyft or Uber to any of the visits here or the scans.
So if you're taking your grandchildren to Tampa or to Orlando, you can be getting tested and be a part of the study there, and they will pay for you to come back and forth to the hotel, right?
Right.
I know that's true because you did it before.
Yes, it's true.
And so
Yes.
we can plan a family vacation to Orlando, and the kids can go to Disney World, or what's the other one? What's the one with the black whale thing? What is he? SeaWorld.
SeaWorld.
And we can go get tested for Alzheimer's.
So this study will ultimately help your clinical site and all clinical sites, because it will expedite participants' ability to participate in research. We will be able to diagnose early Alzheimer's disease more quickly and more economically. It will also benefit folks in private practice because people can use these tests primarily as maybe pre-screeners. So family practice docs, primary care docs who are really in the trenches. I mean, they're the ones seeing Alzheimer's disease all the time. And so they may have the ability to have one of these digital tests in their office, or be able to understand the utilization of some simple blood tests. We do have one blood test that is a pinprick, kind of like a blood sugar test that can be put in an envelope and mailed. We're very interested in looking at that. And so that is a good tool to be used throughout the world where there's not refrigeration and not access to a lot of the other biomarkers that folks have. So it can be used, these things can be ultimately used both to expedite clinical research and in expediting the diagnosis in the real world, so people can understand their options.
And this is actually what happened with one of my patient friends who actually traveled to Orlando to participate in the first study. They brought that information back here and were given a full clinical evaluation, and they did end up receiving some of the medications. So Miss Annette Moffett says, if we travel to Tampa, will we have to make 7 visits, or can some of these tests be made on the same day?
Yeah, it's really 7 separate visits. And it takes place over a period of time. So we say it may take 3 months for people to get the entire, we have up to 120 days anyway, to do all of the tests. And so we work with people's schedules. So it sometimes it's spaced. The major hurdle is getting those brain scans. Not a hurdle, but we have to
You have to order
make arrangements with the scanner. get the tau tracer and the amyloid tracer are made that day for that person. The tracers are extremely expensive, maybe $3,000 per tracer. So we need to make sure that appointment happens. But we can work around people's schedules.
Okay, everybody, you have information in the chat that allows you to call call a contact person to find out more about the Bio Hermes 2 study. And, scheduling what goes on is something that you can talk to the individual scheduler about. And as I've just secured from Dr. Steen, even though you're participating and getting a lot of diagnostic evaluation, or a lot of diagnostic and tools are being used, you will actually get a compensation for it. And that's also a plus, but more importantly, information that you get here that's actionable will be something that your doctor and your neurology and your home base can use to secure a definitive evaluation for you if you have abnormalities. So any more questions of Dr. Steen? Otherwise, we'll go on and get ready to see John. We kind of started with our content first, but thank you so much, Dr. Steen, for spending an hour, almost an hour with us here in Atlanta on our BrainTalk Live. You've given us a lot of information. We do have information in the chat about how to contact you at Axiom Health Center. I call it a health center. That's probably not correct, but the Bio Hermes 2 is offered in 16 different locations across the United States, including Tampa. I brought up Tampa because geographically, Florida is closer to us than someplace else. Chicago, for example. More people are likely to go to Florida from here, just geographically. I see no other questions that we haven't yet addressed. And as Mr. Hart says, you're going to be able to access this particular recording on our YouTube channel within the week.
Dr. Parker, there is one more question. Someone is asking, can they participate while on dialysis?
Dr. Steen.
I would say no right off, but I don't want to say no. So I think we would look into that and see. But if people have chronic diseases, that is difficult. But we can look into that. And if you want to call us, we can give you a definitive answer. But I would think not.
Okay.
And we're
the founder.
And we are Axiom Brain Health. That's who we are in Tampa, if you want to find us.
Okay, I'm going to answer a question. One question I see about CPAP. So if you sleep apnea is one of the risk factors for developing Alzheimer's or related dementia. Being somebody who uses CPAP would not make you ineligible for this study, would it?
It would not.
Okay. So oxygen to the brain, that's why we sleep, and we need to get enough oxygen to the brain because that helps protect the cells in your brain as well. And CPAP does help with cognition to some degree. So sleeping is when we clear out all those bad proteins, and getting enough oxygen to the brain helps maintain the health of the brain cells. So yes, you got CPAP, you're thinking better, good. Keep using it. So, but more importantly for my purpose is having somebody who uses CPAP is not something that keeps you out of this study, right?
That's correct.
Okay, I think that was the more important piece for me to make sure that I address. So in the chat, you have access to Dr. Steen's contact information and Axiom Brain Health. So